Bionox is motivating wellness.
So let's get into the nitrate story. That's where we want to focus at this point. How many milligrams of nitrates is the average American consuming daily?
It's a good question. You've seen it literally nil to in the low milligram amounts. And again, it's really being driven and influenced by one's diet. Vegetarians probably are the highest intakers of these inorganic nitrates. The traditional Japanese diets, extraordinarily high. As we mentioned, a thoughtful paper some time ago did a theoretical calculation of how much inorganic nitrate the DASH diet affords. And that's it approaches 1,000 milligrams per day if one were to be a strict adherence to a DASH diet, which is heavy in leafy greens and beets. And so I would break out your question in two ways. And that is the amount of inorganic nitrates delivered and in what context and or delivery. And the reason I say that, what we've learned, and we've screened a lot of different plant-based processed powders, matter of fact. And we found ones that are very high in NO3, but they're not absorbed. And so that adds another wrinkle to it. So for your folks and your constituents, and that is not only is a certain level of NO3 important, but is that NO3 that you're delivering absorbed? Right. That's the first two. And then the third is, once it's absorbed, is it being a critical step converted to the next intermediate? Hence, that's where the oral cavity becomes so important. And if one were to digress, and we'll come back to the numbers, and I'm always a little hesitant in throwing numbers, but if one looks towards the literature of the clinical papers of some 200 and some odd subjects, from normal tensives to hypertensives, and an array of a dozen probably plus clinical papers, there tends to be a suggestion of in upwards to 5 to 7 millimolars of inorganic nitrate. But like anything in science, we're learning as we go, and some of those assumptions are changing, and it's becoming what we're finding that one might be able to get away with much less depending on how it's presented and in what cofactors are presented with that inorganic nitrate. Hence, the delivery is so critical because it has such a bearing on bioabsorption. That's point one. Two, the health and well-being of our oral cavity. That's a critical step. A very thoughtful paper in Hypertension American Heart Association many years ago by first author Webb. He really drove this point home and how important this is. We eat these leafy greens, or these thoughtfully designed supplements that contains this inorganic nitrate. It circulates back to the saliva gland and concentrates. It's then released into the mouth, and the friendly bacteria, those probiotics that inhabit the back of the tongue, are there to reduce NO3 to NO2, which then goes back into the stomach and absorbed into our bloodstream. And then there's a series of enzymatic and non-enzymatic approaches in terms of when and how those nitric oxide intermediates are then converted to nitric oxide. So it truly is somewhat of a prodrug. So not only is it converted, but there are situations where the body's been designed in such a way where it'll carry these nitric oxide intermediates, not releasing nitric oxide until called upon, so to speak, whether it be in an hypoxic condition or during acidosis, or in context of the appropriate enzymes within our red blood cells to convert that final nitric oxide intermediate to nitric oxide. So it's a very circuitous route, but that pathway involving the oral cavity becomes very critical. If we block that, what we see downstream is a decrease in serum markers for nitric oxide and a decrease in functional outcomes, whether it be flow-mediated dilation, a change in blood pressure, and so forth. So the bioconversion in the oral cavity is absolutely critical for the downstream benefits of creating nitric oxide, hence the introduction of this strip, this next generation strip. And to help people to assess is the oral cavity, are the bacteria present? That's a component of what the strips provide you. Two, is there adequate NO3 being released into the mouth? That's the second part of what the strips provide you. And so we've improved upon the first generation strip with the hope that when users use your strip under your spit, eat, repeat, they'll have an insight of, yes, the supplement that I'm taking or the diet that I'm on has adequate NO3. And two, that the friendly bacteria are intact and doing their job. That's the design of the strip. And so hopefully they'll get 2 red pads. And if so, we would like to believe the semi-quantitative approach, at least they're working in the right direction of sustaining an elevated level of nitric oxide bioavailability systemically.
Gotcha. So just to give an example, the strip, this was what I did first thing this morning. Hopefully we can see that. Is that coming through?
Sure, it's crystal clear.
It's pretty light, right? It's more like this first part of the t-shirt here. That's not where we want to be. And then a couple hours later, after taking my Nox3 Greens, we got this kind of look.
Robust.
Pretty good, huh?
Very good.
So tell us what happened there. What happened?
What happened there? You entered into your day with very low NO bioavailability. The precursors were very low, as shown by that first strip. There were 2 white pads. You took your product that was enriched with really both precursors for both pathways, as I understand it. That top pad that you shared with us after a couple hours is a pad that says, Jay, whatever you took a few hours before has adequate amounts of NO3.
Perfect.
The second pad told you the friendly bacteria in my mouth is intact and it's doing its intended job, converting that top pad to the second pad, so to speak, or the NO3 to NO2, and setting the stage now for your body to now convert NO2 to NO3, whether it be in the stomach, which has its own benefits, as well as ultimately in the bloodstream and in distal tissues such as muscle and so forth, where it's stored, or some of these are stored. So the fact that you had 2 red pads, again, you had adequate dietary NO3, and two, you had an intact microflora, a healthy intact microflora to do the bioconversion for the downstream events to make this beneficial nitric oxide.
Awesome. So that's a good. I got a thumbs up from Dr. Green today. I love that.
And you're ready for the golf course, partner.
Very cool. So just back up a little bit, because this is important. Again, you mentioned you didn't want to throw out a number, but just give us at least a baseline of a per serving in milligrams of nitrates that you have seen to be helpful.
Well, I think, and I'll just default to the clinical studies, because we're working on initiatives to see if we can lower that with the same benefit.
Right.
And right now, it approaches somewhere between the high 2s to the mid 300 milligrams, 5, which would convert to 5 to 7 millimolars of NO3, or let's just say, for argument's sake, 300 plus milligrams is what is suggested throughout the course of the day. Are we advocating that? I tend to look at the evolving science and the outcomes. I think throughout the day, people that are conscientious of their diet and adding thoughtfully designed supplements that introduce certain levels, complemented by having at least a thoughtful lunch or dinner with your leafy greens. If you look at the totality of it, it's not unreasonable to drive those kind of levels throughout the day. Now, as I mentioned, if one adheres to the DASH diet, if the theoretical numbers and some thoughtful publications are correct, it's being suggested that this is driving maybe 3 times that amount. I think what's important is having adequate levels that approach that 5 millimolar mark and upwards to 200 to 300 milligrams. But I'm always hesitant to give hard numbers because, again, is it being absorbed? Is your microflora intact? Because you can give as much inorganic NO3 well beyond that. But if you came off of antibiotics or you're using harsh mouthwashes to decimate that microflora, all this is for naught. So it's one looks at it, your question in context of the other steps involved in that bioconversion process. But as you designed your own product, you're approaching those healthy levels that complement one's a healthy dietary lifestyle. So that's where your product comes in and complements and augments that.
Very good. So, and just thinking in terms of, should we eat nitrates then throughout the day, being that there's a certain lifespan of the effects of nitric oxide? Is that a fair assessment?
That's an interesting question. A series of thoughtful papers. Some of the best papers that are being published are coming out of the UK. And of course, this whole story really originated out of the Karolinska Institute in Sweden. Some very thoughtful investigators and a whole series, and they continue to advance this whole field out of the Karolinska and a series of universities in the UK. A recent paper out of Exeter within the past year did address that very question. And it was suggestive that the delivery and the amount and the bolus amount was probably most effective to achieve that event. But as you mentioned, it wanes over time. It's thought that once you ingest and you start seeing those beneficial effects and goes through that circuitous route from consumption to stomach to saliva gland, conversion back to stomach, and then systemically, we see it peaking around 2 hours with an adequate dose and assuming there's absorption and the mouth does the proper conversion. And then we begin to see it wane within 4 to 6 hours. And then it flattens out, and you are a case study. You probably were elevated last night. You woke up this morning, you tested, you were, so to speak, washed out, and you replenished. And so I think some of the data is emerging that you're going to see these episodic events. And so what makes most sense? Do we want to keep it elevated throughout the day, or are these highs and lows relevant? As I look back at my drug discovery days, I would argue and lean towards the fact that more is not necessarily better, but a steady, elevated state probably makes most sense, because often we find ourselves either depleted or not. And I think those elevated states and what that elevated state and how long we could prolong it might emerge to be the most beneficial in terms of our health and well-being.
Gotcha. Appreciate that. So what about testing then? Should we test more than once a day with the saliva strips, or what do you think about that?
I hear all sorts of arguments on that, or thoughtful comments on that. And I see across the population, the feedback that I'm receiving are people who are at least testing minimum twice a day, establishing just as you did. You got up, you tested your base, established your baseline, and then 2 to 3 hours thereafter looked at what I introduced. Did it elevate? And then possibly a third test at the end of the day in terms of what my status is, because we do know nitric oxide has a big effect on a number of physiological outcomes, including your sleep pattern. So the question is, should one be going to bed with an elevated level of NO or elevated level of bioavailable NO? Hence, its impact upon sleep and breathing patterns throughout the night. So again, the data continues to emerge.
Yeah, good. Very good. Appreciate that. I just want to share real quick. I'm going to share my screen just to give you another testimonial. Of course, results may vary, right?
Right.
For individuals. But here's a little plethysmography test. This is something that I've been doing since 2005, have tested thousands of individuals using this. It was a great way to be able to test people, get a baseline screening. It's a non-invasive test, and then introduce the nutraceuticals, rescreen in 90 days and see what kind of results you get. And interestingly, when people do the right regimen, about 90% of the people respond favorably after 90 days of using the nutrition. So you can see it there, right, Shawn? You can see it?
I can.
Yeah, so you see the large artery circulation is wide open. This is mine that I did. I had worked out at 8:30 that morning. I'd taken my full dose of 2 scoops of the M3. I took 1 scoop of the Nox3 Greens.
Wow.
So what you see there is an ideal plethysmography wave pattern. So there's 7 different possibilities of a wave pattern. What it's really measuring is arterial compliance, flexibility, how well the blood is flowing. And as you can see, type 1 is as good as you can get it. I started doing this in 2005 when I was 35, doing this testing. I was a type 2 back then. Here I'm 51 and testing as a type 1. So so it just gives you a little show of what these nutrients, these precursors, both nitrates, arginine, citrulline, what their capabilities are, and some of this cool technology outside of the saliva strips, what's available out there. And so when I first got involved, these testing gadgets were like $6,000, and they were only available to medical professionals. And now we have them for $500, and they give you the same data. And people can do this at home and monitor their progress. So pretty cool stuff.
And this kind of, and I'm seeing more of it. And I think COVID brought it on, where people are taking more responsibility for themselves. They're monitoring themselves differently. And hence it's driving compliance. And you were a testimonial just now, having these tools, getting this immediate actionable feedback in which it's changing your, either driving compliance or changing your lifestyle, whether it be a rapid test strip saying, I'm intact, I'm eating adequately, and then having a hardened outcome, a physiological outcome. And these kind of tools become, I think, more embedded in people's daily practice now. And I think we're only going to see an increase. Just the emails that we get and the feedback that we get in terms of, I'm learning more from individuals that are sharing with me their dietary diaries in terms of, here's how I'm influencing it. And it's absolutely fascinating. But I would argue COVID has actually, there's always a silver lining to these god awful, and it's changing people's awareness and their approach to solve problems, remaining compliant, and getting through the information that they're trying to amass to improve and focus on prevention rather than disease management. And again, case in point, what you just shared here.
Right. Yeah, definitely self-care has become an all-important, very interesting concept. More and more people, I think, are getting blood pressure cuffs, keep them in the house. They're getting, things to prick their finger to check their blood sugar in the morning. This is great. Anything that people can do to monitor themselves on a daily basis is really a great concept.
Join Dr. J next time in episode 3 with Dr. Shawn Green.